I'm John Moore. I'm a gastroenterologist here at Fayetteville Diagnostic Clinic. I'm originally from Fort Smith, Arkansas. I went to college here at the University of Arkansas and studied chemical engineering. And then I did my medical school at UAMS in Little Rock, followed by an internal medicine residency there. And then finally, I did my gastroenterology fellowship in Buffalo, New York, before coming back to Fayetteville to settle down. When discussing cancers, colon cancer is very common. It is the third most common diagnosed cancer in men and women, and unfortunately it's the number 2 cancer killer in men and women. In 2007, about 142,000 people were diagnosed with colon cancer, and about 52,000 people died from colon cancer. It has equal incidence in men and women, and there are some studies to suggest that it has a higher incidence in the African American population. The risk of colon cancer increases as we get older, and in fact you'll find that about greater than 90% of colon cancers are diagnosed in people older than the age of 50. There are several risk factors associated with colon cancer: a history of inflammatory bowel disease, a personal or family history of colon polyps or cancer. There are genetic colon cancer syndromes. A low-fiber, high-fat diet, obesity, tobacco abuse, and alcohol are all associated with colon cancer. In short, everyone should be screened for colon cancer. It's important to remember what a screening test is. A test or procedure to detect polyps or cancer in your colon when you are healthy and not having any problems is a screening procedure. If you're having blood in your stool, changing your bowel habits, or other problems, that would be a diagnostic procedure. So for purposes of colorectal cancer screening, everyone should begin, men and women, at the age of 50. The only caveat to that rule is that African Americans need to begin colorectal cancer screening at age 45 for men and women. They've been proven to have an increased incidence of colorectal cancer and polyps. Although we're getting better at screening everyone for colorectal cancer over the years, we're still not perfect. In fact, about 1/3 of patients over the age of 50 do not participate in colorectal cancer screening. And it's thought that about 60% of deaths from colon cancer could be prevented by getting the whole population screened. You do not need a referral from your physician to schedule a screening colonoscopy. If you're having a specific problem with your colon, such as blood in your stool, a change in your bowel habits, or abdominal pain, that is a diagnostic colonoscopy, and you do need a referral from your physician for that. There's a couple of ways which you can schedule a screening colonoscopy with us. You can visit our website at www.northhillsendoscopy.com, and we have a link on there to request a screening colonoscopy. You can fill out some of your information, and we will call you back to schedule. The other way is by calling our endoscopy center directly and speaking with our scheduler, Christy, at 582-7289.